In this video we are going to discuss about the cell adaptation. So cell adaptation. So there are cell adaptation is the reversible change. It is a reversible change which is occurred in a cell. Reversible change occurred in cell in response to physiological or pathological stress. Physiological or pathological stress. Cell adaptation. So this cell adaptation is further divided into the 5 types. First is atrophy. Second is hypertrophy. Third is hyperplasia. Fourth is metaplasia. And last one, that is fifth, is dysplasia. So let's discuss each one by one. So first, that is atrophy. So atrophy is nothing but decrease in the size of cell. Examples of atrophy are there are further classified into 2 types as physiological atrophy and pathological atrophy. Example for physiological atrophy is atrophy of thymus as the age increases. And examples of pathological atrophy are disuse atrophy of muscle due to impaired nerve supply. Then second is hypertrophy. So in hypertrophy there is increase in size of cell. Examples for hypertrophy are so physiological hypertrophy and pathological hypertrophy. Example for physiological hypertrophy are hypertrophy of skeletal muscle during exercise, and example for pathological hypertrophy is left ventricular hypertrophy of heart. Then third one, that is hyperplasia. In hyperplasia there is increase in number of cells. Example for hyperplasia are physiological and pathological. The example of physiological hyperplasia is hyperplasia of breast during pregnancy. An example of pathological hyperplasia is benign prostatic hyperplasia of prostate. After hyperplasia there is our dysplasia, metaplasia. So metaplasia stands for conversion of one type of epithelium to another type. The types of metaplasia are, there are 2 types of metaplasia. One is squamous metaplasia and other is columnar metaplasia. In squamous metaplasia, the columnar epithelium is converted to squamous epithelium, and in columnar metaplasia, the squamous epithelium is converted to columnar epithelium. So example of squamous metaplasia is trachea of smokers. So generally, in our trachea, there is pseudostratified ciliated columnar epithelium, which due to smoking converted into the squamous epithelium. And example of columnar metaplasia is Barrett's esophagus. So in Barrett's esophagus, normally esophagus have squamous epithelium, but in case of Barrett's esophagus, this squamous epithelium get converted into the columnar epithelium. So this is the example of columnar metaplasia. So after metaplasia, let's look at dysplasia. So dysplasia. So dysplasia is the next step or next stage of metaplasia. And this dysplasia is characterized by 7 features. So DYS PLASIA. So here D stands for disordered arrangement. So there is disordered arrangement of cells. P stands for pleomorphism. So there is nuclear pleomorphism in dysplasia. L is loss of basal polarity. Loss of basal polarity. I is having 2 components as increased nucleocytoplasmic ratio and increased mitotic rate. So 1, 2, 3, 4, 5. There is one more, that is increase in there is hyperchromatism. And one more is there is increased number of layers of cells. So these are 7 characteristics of dysplasia. D stands for disorder arrangement. Here P is pleomorphism. I is L is loss of basal polarity. I 3, that is increased nucleocytoplasmic ratio, increased mitotic rate, and increased number of layers. And last one is hyperchromatism. So 7 characteristic dysplasia. This dysplasia will continue and transform into the tumor.